For the past 20 years, professional baseball and the Professional Baseball Athletic Trainers Society have worked together to educate both our players and fans about the dangers associated with spit tobacco. The reason professional baseball considers this an issue that needs to be addressed is because spit tobacco, also known as chew, dip, or snuff, is a dangerous and potentially deadly addiction that harms both players and fans alike and should be avoided. Many people use spit tobacco because they're led to believe that it's less harmful than cigarettes, which is simply not the case. Using 2 cans of spit tobacco per week is the same as smoking 1.5 packs of cigarettes per day. And spit tobacco users have an 80% greater risk of oral cancer than non-users. And cancer does not care if you're a rookie or a veteran. Sadly, spit tobacco and the various forms of cancer it can cause has already taken its toll on the immediate family of baseball. Some of the game's greatest names, such as Hall of Famer Tony Gwynn, umpire Doug Harvey, and many believe even Babe Ruth has been victimized by this disfiguring and deadly addiction. One of the greatest players in the history of baseball, Tony Gwynn's Hall of Fame career was marked by his incredible abilities on the field and his shining character off. Tony was also known for his spit tobacco use, and in 2010, he was unfortunately diagnosed with oral cancer. Over the past 4 years, Tony has had multiple surgeries and rounds of chemotherapy. When asked if spit tobacco caused his cancer, Tony said without hesitation, of course it caused it. Like the pro he is, Tony is still battling this cancer and offers these words of advice.
My advice to anyone would be if they aren't using spit tobacco, please don't start. And if you are using, try to quit. If not for yourself, then do it for the people you love.
Although all forms of tobacco are extremely dangerous, most spit tobacco users can often begin to see and feel many of the danger signs of their addiction almost immediately. Some of these signs include bad breath, cavities, nicotine addiction and dependence, stained teeth and tongue, gingivitis, gum recession and sensitivity, loss of sense of smell and taste, elevated blood pressure, and mouth sores and ulcers. Eventually, these warning signs often give way to more serious health hazards. For approximately 75% of spit tobacco users, the initial mouth sores and ulcers begin to turn into leukoplakia, a precancerous condition of the mouth that looks like white patches and oral lesions on their cheeks, gum, and tongue. This increases the user's risk for cancer of the mouth, esophagus, pharynx, larynx, stomach, pancreas, and bladder 4 to 6 times more than the non-user. Not to mention increasing their chances of heart attack, stroke, and tooth and bone loss. Every major health organization in the United States and abroad agrees that spit tobacco is a bad health choice and should be avoided. If you would like help quitting a tobacco addiction, or you would like to get information for someone you care about, please contact your athletic trainer, club EAP director, or any of the organizations listed on the screen. We leave you with the words of Bruin Von Behrens, a young man who was diagnosed with oral cancer only 3 years after he began using spit tobacco. Now 27 years old and 40 operations later, with his lower face severely disfigured, his lower teeth and jawbone gone, about half his tongue and neck muscles missing, his face patched with skin and muscle from his leg, Gruen pleads with all who will listen.
I feel for 2.5 years when I was diagnosed with cancer. It don't take a long time. People need to realize that it's a harmful drug.